In 1984, Kenya reported its first case of HIV, sending panic and shockwaves across the country. Coupled with inadequate information about the virus, stigma was the immediate calamity that befell those who tested positive for the virus, and they would often die in isolation after enduring months of suffering. However, the country has since made significant strides in medical research and social acceptance, leading to a declining rate of AIDS-related deaths. And as the country gears up to mark 4 decades of concerted efforts to eradicate HIV as a public health concern, Otieno takes stock of how far the country has come in fighting the AIDS epidemic.
I think we owe it to the generation today to know where we've come from as a country. The terror that the virus caused in this country and on the globe can only be simulated close to what happened during COVID-19. There was fear. There was death. And there was uncertainty of what is really going on.
Kitambo unajua mtu alikuwa anataka tu ajifiche. Hata kama ni hiyo dawa unataka uende uchukue kama mtu akuoni. Saizi tuko free.
40 years down the line, we have a clear understanding of what this virus is about, what we can do about it, and we have seen systems built, interventions put in place, and people are living with HIV and able to participate in economic activities. Lest we forget that.
At the outskirts of Kisumu City, Roslida Auma knits her mats. Each stroke of the crochet weaves a tapestry of hope and resilience. The tight-knit pattern illustrating persistence and a spirit that fights to rise above board. Roslida tested HIV positive while on a prenatal visit when she was pregnant with her youngest child, who is now a teenager. Shaken by the diagnosis, she ran to her father.
Asa jambo lake kwangu ilikuwa tu, unakumbuka nikiwa mgonjwa ukiwa mdogo? Nikamwambia nikamwambia ni ugonjwa wa sukari. Hiyo ilikuwa ni ugonjwa. Sasa kama umepata hii, usiwe na wasiwasi, meza tu madawa. Unaona mimi pia nikiwa hai. Sasa wewe meza madawa na usikose kumeza hata siku moja. Utakuwa hai, utazidi tu kuwa hai. Na hivyo pia mimi nikakaza moyo na nikawa na hiyo roho. Juu kama baba yangu alianza kumeza nikiwa class 6, mbona sio mimi nimeze?
Her husband passed on shortly after she was diagnosed. However, enveloped by encouragement from her father, Roslida took her assigned medication. At the back of her mind, she feared for the health of her unborn baby. However, when her son was born, she took the leap of faith and consented to have him tested for HIV.
Nilipoambiwa mtoto ametoka bila virusi, nilisikia vizuri juu niliona afadhali yeye amekuwa sawa, hajatoka na hizo virusi. Nilimwanza jina Livingstone, kumaanisha jiwe lenye uhai.
According to data from the National AIDS and STI Control Program, NASCOP, the country has reduced mother-to-child transmission of HIV to 7.4% from an upward of 14% in 2013. Additionally, 1.3 million people are on antiretroviral therapy, including 48,000 children. Roslida takes a trip to the Lumumba Sub-County Hospital for review and a refill of her pills. She is among the 7,346 clients served at the Lumumba Sub-County Hospital in Kisumu. The Comprehensive Care Clinic, which was opened in 2007, serves not only the population around Shaurimoyo and Kaloleni in Kisumu, but clients who travel from as far as Mombasa and Murang'a counties. Today, a peer-to-peer counseling session is underway. Every day of the week is assigned for different groups in a bid to not only foster a community for persons living with HIV, but also diminish the cloud of shame and fear that hang over those who test positive.
Within the facility, at times you might have a client who has been exposed, and then maybe you have this client inside your room, or maybe the client has just come in for treatment, and then he's like, oh, I'm seeing a neighbor there, I will not come in. Reason being, it's all about stigma. If you see a young adolescent within the facility, see, definitely you'll ask this kid that, do you know the reason as why you are taking your drugs? The client will just tell you, I don't know. Like, really, you haven't been told by maybe your parents or something? And then the client will just say that, I don't know. My mom told me that I'm taking these medications because I have a chronic illness. Maybe I have pneumonia.
1.3 million people in Kenya are living with HIV as per the National Endemic Diseases Control Council. 59% of new HIV infections in 2023 were recorded among adolescents of 10 to 19 years in 10 counties, we have the patient line including Kisumu, Migori, Nakuru and Kakamega counties. The new revelation calling for more concerted efforts to address infections among the adolescent population.
And for young people, it's a concern, you know, because if we were to break the cycle, the generational cycle of new infections, the young people are the ones who get children. So when you have infections in a younger generation, then the mother-child transmission cycle will continue. And you can't break that generation of new infections. So we are very keen when we see that the rate in young people is still a concern, we must talk about it, because that's the only way to cut off the continuous generation recycling of HIV.
Yeah, even us as a staff, we have noted that most of the times they come for the pills to prevent pregnancy. We even give them condoms, but when they come for the pills to prevent pregnancy, then it tells you they're not using the condoms. And yes, we are even trying to go even to the, like in Lumumba, our catchment area, we even have schools like the Kisumu National Polytechnic. We have some colleges that we go to, talk to them, but you realize sometimes that we still have a lot of teen pregnancies and even the young people getting pregnant.
In spite of the rising infections among the young people, the country has made significant strides, including the Undetectable Equals Untransmissible campaign, which aims to suppress the viral load amongst people living with HIV through adherence to antiretroviral therapy. Currently, 1.3 million people are on ART, leading to a 65% reduction in AIDS-related deaths. The adherence levels have been bolstered by the evolving research in the medical field to develop drugs that are less toxic to the user.
Earlier, we used to have the 3 drugs separately. Right now, it is just 1 pill. Then the 3 drugs were even taken maybe twice a day. Right now, you take it just once a day. So that is how we have moved, trying to make taking the drugs as simple as possible so that we don't have the patients defaulting from the drugs.
We have clients that are virally suppressed and our suppression rate is 98%. And we are working to achieve 100%. So one of the reasons why we want our clients to be virally suppressed is, one, to increase the efficacy of the drugs in the body. Another one, to improve their health, because the moment the client takes the drugs well, then automatically their health will be good.
At Lumumba, as the world marks World AIDS Day on Sunday, the celebrations are underway. The clients at the Comprehensive Care Clinic are not just documented cases, but dignified individuals who contribute to the country's long strides in efforts of eradicating the AIDS epidemic.
As at now, if you are not HIV affected, then you are HIV infected. And people should normalize this and take HIV as one of other diseases just like malaria. We should stop stigmatization and embrace it and give these people an ear to, we should understand them, that this is one of the things that they need so that they live a healthy life.
Watu wanarudi kupatana hapo, wanaoana, maisha inaendelea mbele. Hasa ni group pia inapatia watu courage. Sasa unajua ukikaa na wenzako uone hata kama ulikuwa umedhoofika na uone mwenzako amenenepa, so utasema ai, na mbona mimi nakaa hivi na huyu ndiye amekaa hivi. Sasa utajaribu ujue ni siri gani anatumia, ama anameza madawa kiasi gani, ama amejilinda kiaje, na wewe pia ufuatilie.
Kenya's journey with HIV is not a narrative of an epidemic, but a chronicle of hope, meticulously crafted, courageously sustained, and powerfully transformed. Otieno, Citizen TV.